So good morning, everyone. I'm happy to be here today. My name is Khozya. I know the struggle to pronounce it, but that's okay. So my name is Khozya, and I'm coming from Zambia. I work for the Ministry of Health as a pediatric HIV advisor, and also with the adolescent team on the HIV programming. And so what we'll do this morning is share with you lessons from the implementation of the adolescent HIV surge that we did in 29 districts in Zambia. And so what happened is that as at 2019-2020, Zambia was far away from achieving its 95 as a country, and particularly for the adolescents, we see that we were really below the 95 targets. And this was such a great concern that we decided to initiate the adolescent HIV surge. And this was a multi-sector coordinated effort that involved the civil society organization, the Ministry of Health, the adolescents themselves, including the implementing partners. And so we set out to want to achieve enhancement in HIV prevention amongst the adolescents, close the gaps in case finding, improve linkage and retention, improve viral load coverage and suppression, as well as improve partner coordination, which we felt was going to help us to achieve some of the things that we wanted to achieve in this group. And so what we did during this period was to set up a sub-technical working group that looked at this particular implementation, and this was composed of the players that I've highlighted. And this surge was implemented in the period between 2020 and 2022 in 29 districts of 116. So we selected these particular districts based on the adolescent number of coverage. Those districts which had a coverage below 90% those are the ones that we selected, and we included in this particular surge. And we decided on the targets, and we assigned them, and we were able to follow up each facility in those districts, monitoring the number of tests that were being done, monitoring those that were continuing on ART, and monitoring all those that were being initiated on PrEP amongst the adolescents. We developed an implementation plan where we developed key strategies for prevention, treatment monitoring, as well as other adolescent-related services. We developed a monitoring and evaluation framework where we collected data, online dashboards, and also we held bi-weekly meetings and quarterly performance meetings just to monitor the progress. So what we found out during this, at the end of this implementation period, was that we had quite a drastic increase in case finding, and in the first year of implementation in 2020, and then as we went on, the positivity remained higher than the baseline, and so we were able to increase the number of people that adolescents that we're finding in the surge districts. And then also we noticed that the initiation rates remained quite high. Amongst those that we're finding, the initiation rates remained high. We further noticed that the viral load coverage, which was quite poor at the beginning of the surge in these particular districts, also increased during the period of the surge. And we also noticed that the viral load suppression also increased in the period of the surge. The uptake for PrEP during the period of the surge also was noticed to have increased, and you can see there from 2021 to 2022 there was an upsurge in the uptake of PrEP. So what do we say following this period of implementation of a surge? And so we think that adolescent HIV surge showed quite an increase in the case finding, PrEP uptake, as well as improved viral load coverage in the district that we're implementing. And then also a multi-sectoral coordination provides an opportunity to improve implementation of activities. And there is need to adopt person-centered approaches and address structural barriers to ensure access to primary health care services across our district, and that upscaling of adolescent SAGE has the potential to significantly reduce new HIV infections among AYPs and improve treatment outcomes. We want to acknowledge our support from Ministry of Health leadership and also Invest Teaching Hospital, National AIDS Council, and our partners that were able to support this work, CHAI, CIDES, and Zambia Pediatric Association. Thank you so much for your attention.